Hello, everybody. Good evening. I hope you're doing all very well. We've had a wonderful time during the day.
Hello, everybody. Good evening.
So, to close our event today, I'd like to welcome Professor Glaucia Salgado. She presently lives in North Carolina, the United States. But she has a Master's of Arts. She is a Master's of Arts candidate at Duke University in the Institute of Global Health in North Carolina. And she also holds a master's degree in gerontology from Simon Fraser University in British Columbia, Canada, where she worked with community-based senior services in the mental health of ethnic, visible minority, older adult immigrants. But Glaucia is Brazilian. In fact, she graduated at physical education in the center of São Paulo. And she has received six awards for academic excellence. And she's currently involved with a project that is studying dementia among older adults incarcerated in the US prison system, and a study on gender-based violence. So, besides presenting her work with older adults on international conferences, she has co-authored an ebook entitled Making Sense of a Global Pandemic, Relationship Violence, and Working Together Toward a Violence-Free Society in 2020. And another book, which title is Ajisma in Movies, Cartoons, and Other Media, an Opportunity for Education. Other previous projects include the Canadian Longitudinal Study on Aging in 2015, and Older Adults Digital Storytelling Project from 2016 to 2019 at Simon Fraser University Faculty of Education. So we'd like to thank you, Glaucia, for accepting our invitation. And the subject she's involved in within her research has everything to do with the whole team that we have been, the whole subjects that we have discussed throughout the day. And just to remind you all the guiding questions that we have been trying to address during the day, I'd like to repeat them here. So, what has COVID-19 pandemic meant to you, and also, Glaucia, to the people that you work with? And thinking of the future generations in 10 or 20-year time, how do you think you will narrate your experience amidst the COVID-19 pandemic? And how do you think your life or our lives will be like after this pandemic? So I leave with you the word, thanking you very much for being here with us.
Thank you, Carla. So before going to the presentation, I would like to address your questions. So I think it's going to be in the future. I hope we are more willing to cooperate with each other. And I think might become more able to be kind with one another, because everybody is going through the pandemic, but the situations are very different. I see that with my participants in Canada. So I hope we are able to see what people are going through and maybe help with their needs, not only think about us, but also think about them.
So, it's interesting, Glaucia, because this is something that quite a few people have remarked today, that this would be one of the contributions or maybe the result of a learning process that we have been through, or we are still going through this pandemic.
Yes, I think there's a lot to learn. Of course, there's a lot to do for the pandemic, and to be able to have like normal lives, but yes, absolutely. Yeah. So I'm going to start my presentation, and it's going to be about older visible minorities who live in Canada. So I have my PowerPoint here, and please let me know if you can see my presentation.
Not yet.
Not yet.
Yeah.
Okay, let's see.
Yes, now it's okay.
Now it's okay. Okay. So let me just organize my screens here. And you see me too?
Yes.
Okay.
Good.
Okay, good. So as Carla was saying, I work with visible minorities in Canada. Although I live in the US right now, I still have a lot of connections with them. So when the pandemic started, I start to have some questions in my mind because my university in Canada, they were doing some papers about the pandemic. And since I work with visible minorities, I decided to interview them and learn what their struggles were and what they were trying to do and they were not able to do. So that's how I came with the whole presentation today. But before starting, I would like to do something that I learned to do in Canada, which is land acknowledgement. So I'd like to say that I acknowledge that I work in the traditional, ancestral, and unceded territory of the Coast Salish peoples, and I live in the Catawba and Sugari Indian Nation territory. And I know we are today presenting these workshops from the lands of Minas Gerais, which used to be the lands of Aboriginal people from Araú, Macang, and Guarani, and many other Aboriginal people. So I start with telling a little bit of Canada and why I thought this was important to understand. So we know that the number of older adults are increasing everywhere in the world, including Canada, the US, Brazil, and many other countries. And in Canada, we classify individuals as older adults, everybody who is 65 and plus. I know other countries do that classification differently, but that's what happens in Canada. And we have about 6.6 million older adults, which is 17.5% of the population. And from this number, 12.3% are from older visible minority backgrounds in Canada. So all these individuals in Canada, they come from very diverse population groups. They come from many different countries. I think you might know that Canada receives a lot of immigrants. So they tend to classify people. I think they like to give names to everybody. So they call visible minorities all people who are not the predominant ethnic racial group, and usually not white people. And they also call everybody who are non-Caucasian in race or non-white in color, except the Aboriginal people, visible minorities. But there are other ways also to categorize people as visible minorities because, for instance, women can be seen as visible minorities. I am white, but I'm from Latin America, so I can also be seen as a visible minority. So it depends. It depends on what you are trying to say and what type of target population you are working with. So since this is all about storytelling, I don't want to just say things that I have in my PowerPoint, but I want to just give you guys a little bit of background information. So then we go to the stories that I have. So in Canada, the majority of older visible minorities, they come from East and South Asia. Then the second place is South Asia, Latin America, Black, and Arab. This is the way the Health Canada categorized them. So that's why you see Black and Arab, which doesn't make sense with the other names, but that's the way they categorize people. And you see the sizes of each square. It represents also the size of each population, meaning East and Southeast Asia are the biggest population group, followed by South Asia, then Latin American, Black, and Arab. And then I'm just situating you here. So Canada is so big, and these people that I'm gonna talk about, they live in British Columbia, and the city where they live, the name is Vancouver. So they have in Vancouver, which is this part that you see here, it's in British Columbia. Visible minorities tend to live in small communities. They usually live with other family members, but they tend to be very alone because everybody is working, everybody has to go to school, everybody is busy. They are usually low income. They are immigrants in Canada. They came many years ago. Some of them came like 50, 60 years ago. They are now aging in Canada, but they came from another country. This group that I'm going to talk about, they are from 55 and over years old, and usually women. I didn't have a chance to know about any stories about men. Unfortunately, they usually don't attend this type of organization. There are some, but I have to confess that majority are women. So this is just a little picture that I have from Vancouver. This is Chinatown in Vancouver. It's one of the streets in Chinatown. And since Vancouver has a lot of Chinese immigrants, it's very, you usually see a lot of places that have names written in Chinese, and you have specific stores just for Chinese population. I'm just going to change a little bit here and say why I'm going to talk about the neighborhood house. So all these immigrants, they tend to live in a specific area in Vancouver, and this is close to the east side of Vancouver. And where they live, there are some organizations that provide services to them. And these organizations, they are like we have in Brazil, SESI or SESC. They provide a range of services. They provide food, they provide physical activities, mental health support. So these seniors, they usually live in this part of the city, and they usually access those type of organizations that are more culturally sensitive. They know about culture, they know about diversity, and they try to accommodate all older adults according to their culture. And they also try to provide programs that are sensitive to their culture too. So these seniors, they usually go to places called neighborhood houses. Those places, they provide, like I said, many services, but everything is planned. It's not like just doing physical exercises like any other place. They think about providing services that can be person-centered. They think about providing services that are affordable to everybody, so everything is free. They try to be suitable to everybody's needs, and they also think about comprehensive models of health, which is something that programs that try to understand health needs, but not only in the sense of medical approach, but also in the sense of having a community, having people to support you, and other things like that. So these seniors, they go to those neighborhood houses, and they connect with others. They get access to services available also in the community, like, for instance, if they need to see a therapist, they go to the neighborhood house, and the neighborhood house help them to find services available in the community, which are also tend to be free. and they have activities during the day. They have food resources, because for this population, like I said before, they are low income, so they face risk of not having enough food to put on the table. So they have the neighborhood houses, they provide that to them. They also provide daycare services for children and grandchildren. So people feel part of the community, and they have engagement projects to all the community, and which help them to feel a sense of purpose. So it's a very comprehensive type of support and services that they provide to older visible minorities. And like in Brazil, those who take care of kids are usually the grandparents. So that's why they also provide services to grandchildren. So grandchildren can be busy and the grandparents can be doing something for them inside the neighborhood house. But then when the COVID came, all these services had to be shut down. There was the time not to go outside. Everybody had to be inside the houses, and these people were not able to access any services in the community. The lockdown in Vancouver was very harsh. They had to do that. I completely understand. The healthcare system is public, so they had to be very careful with the number of cases. So it was a very hard situation for older adults, because, as I said before, they were used to access services like food, activities, all in the neighborhood house, and suddenly all things were closed. So they were not able to do that anymore. So all these measures came to Vancouver, as we also had in Brazil. So physical distancing, lockdown, all all trying to help to contain the spread of COVID. So everybody was most people were trying to follow the guidance. And this is a picture of the city when the lockdown was happening. So everything was closed, nobody was on the streets. So as you can imagine, it was a very hard time for everybody. And like Brazil had the same, so everybody can rely to that, can relate to that, because it was the same for all of us. So for this specific group of population, they had specific challenges, which I think it might be similar to the ones that we had in Brazil. So these seniors, they feared contracting the disease. They were not able to have access to safe transportation. They usually live very far away from supermarket, not very far, but far enough that they have to take a bus. So they were not able to take a safe type of transportation to go for groceries or a physical a doctor appointment or getting medication. And they also faced challenges with trying to do online shopping, because they didn't know how to do that, and financial constraints, because remember again, they are low-income population. So these were some of the challenges. But on top of that, let me see if my PowerPoint will change. They were also facing discrimination. So before I said that most older adults in this part of the city, they come from Asia, and most of them come from China. So they were facing, I had a chance to speak with them, and they were facing a lot of discrimination in both forms that I have in the PowerPoint. It was ageism and racial discrimination. So for those who don't know, ageism is a form of discrimination that has actions toward others on the basis of negative perceptions, on the beliefs that the actual perceived chronological age on the individual, it's bad. So that's just something about ageism. So you discriminate, you try to say, it can be like saying bad things or even not having access of services because of your age. And then they also faced racial discrimination, which we all know, like not, it's the intentional action targeting a group of population from specific racial groups. So that was very hard for them because they were facing both types of discrimination. So, and I had a chance to collect some of the experiences that people went through. So I have here for you to show just now, like Bianca, that's just a fake name that I gave to her. She said to me that she was trying to avoid going to the supermarket because she knew every time she had a mask on, people would look at her and say bad things just because she was Chinese. And she thought that was also because she was old. And then Marisa, she said to me, I was followed the other day by someone who was calling me many bad names. He said that I should go back to my country and then stop spreading the virus here in Canada. Just a detail, she lives in Canada since she was 18 years old, so she was very sad with the whole situation. And then Mimi, she told me, I know people are afraid of me, but I can't do anything. I'm old and Asian, and this is very hard moment to be an older woman from China. So from these experiences, you feel the environment that was going on for these people in Vancouver. It was a very hard time. It still is, but now it's getting a little bit better. But since we're talking about the challenges, I'm just showing you some of the experiences they had. Tammy also said, I saw the other day a woman being beaten on the street just because she was Asian and old. And I think people forget that we have nothing to do with this virus. So they went through all these very hard situations with the COVID pandemic. And I also had a chance to interview some of the staff members from the neighborhood house that I work with. And they told me that they remember the community not being able to get medication, not being able to see a doctor because they were afraid of going out. So this is very serious because then on top of the pandemic, you are not able to get access to resources, essential resources, because you fear being discriminated on the street. And Amy, another staff member, she told me, seniors are feeling very distressed, not only because of COVID-19, but also because people don't care about them. So it was a very hard situation for sure. And I feel for these seniors because I know them and I see that everybody went through so many things, but I feel for them because it was very targeted to them. So as a consequence, they all felt very isolated, they felt lonely, and they had limited access to essential services, as I said before. So that was very heartbreaking for everybody in the community. So what the organizations did, they realized that this situation was going on because although they were closed, they were trying to call people, making sure they were okay. So they knew they had to find a way to operate again and help these individuals. And they noticed that because before these organizations, they were a very key resource for these people, they would have to still be a key resource during the pandemic. So they knew they were like an essential way to foster resilience in the community. So what happened here, in order to foster resilience, they started to change the way they offer the services, and they started to see the ways that they could support the community. So it was a combination of offering services and also connecting to the community and helping these things work well. So I'm just going to tell a little bit what they did. So before they were doing friendly calls, they call it friendly calls to check if everybody were okay. So they intensified the friendly calls. And what happened is that the the community, they started to realize that these things were happening, and they made referrals to the organization to call like neighbors or to call mother who were alone. So everybody was, they were trying to work together. So because sometimes it's not possible to know who needs help, so they counted on other people to make referrals to the organization, and then the organization called the seniors. So that was very essential to understand their needs. So these calls were also made as an effort to relieve anxiety, distress due to isolation and discrimination, because during the calls, I had a chance to make one of those. We would talk about other things, and also because they were all day alone, many family members were working, unfortunately, well, maybe fortunately, because they had money to buy things, but they were alone and they were very distressed. So it was a form to help them cope with the whole situation. And they also, the organization realized that these seniors, they were not having access to enough food or hygiene items, not just because of money. In some cases, the money was the issue, but in other cases, it was the discrimination portion. So they were afraid of going out and having to do with discrimination. So the organization knew about that. So they started to deliver food and hygiene items. And they also started to check if they were taking their medications and if they were able to go and to the pharmacy and get, for instance, a whole bottle of pill for blood pressure. Some of them were not able to do that again because of fear of going out. So the neighborhood house started to make the connection between seniors and pharmacies, and they were able to pick up medication and deliver it to them in their own houses. So that helped a lot. So after that, they also created some online programs. They made a campaign to collect tablets from donations, and then they donated to seniors. And they also offered help like one-on-one help calling seniors, because somehow they like calls. So they called seniors and teach them how to use the tablet, how to use the Zoom, how to use WhatsApp. And they started to provide programs, like they have something called Drum Circle. It's indigenous people who plays, and then they all play, they sing together. It's just a form of connecting with each other. So they started to do that online. And they also had something that Gloria, somebody that I interviewed, and I'm going to show you guys, she calls the wellness connectors. So the wellness connectors are seniors helping other seniors. So they called other seniors who were more vulnerable in order to provide like just a year, just like helping to hear somebody, listening what they are going through, as a form of helping to cope with the whole situation. So I have a video here, and I'm going to show an interview that I did with Gloria. Gloria Tissu, she's a coordinator at Frog Hollow Neighborhood House. She provides services to seniors and their family members. And I asked her some questions about the pandemic and what they did. So I want to get you guys to hear from her what happened over there. Gloria, I know you work with an organization in Canada, and you provide service to older adults and also family members. Can you tell me a little bit about your work?
Yes, sure. I work for a nonprofit organization called Frog Hollow Neighborhood House. We are situated in the northeast side of Vancouver, in Canada, and it is basically a home away from home for community members. So it's an organization that provides services for children, such as daycares and preschools and before and after school care, and also for youth, different programs to connect youth with each other. We also have seniors programs and family drop-in programs. So the idea is to provide services and opportunities for community to come together and to offer their own skills to the community, share with each other. And one of our mandates is to empower people in the community. So this is part of what we do.
It's a beautiful organization. I know you guys.
Yes, and we miss you a lot.
Oh, I miss you guys too. So Gloria, I have some questions about the pandemic. So I will start from the beginning. So how did you learn about the COVID pandemic?
I remember I heard about it for the first time when I was with my staff team. We were actually having a training session. And at the end of the training, our director brought up that she's heard that there's a pandemic happening in China, and that there's talk about us having to do a lockdown in Vancouver, and this might happen quickly. And so at first I didn't actually believe that we would have to lock down. I felt like maybe somehow we would avoid it, but then the reality set in. That was the first time I heard about this virus that was circulating.
And then did you guys end up having a lockdown, right?
Yes. So yeah, because we were in training and we were doing some program planning, it affected our program. So we had just been prepared for the possibility that we might have to stop programs. So I think it was shortly after that that training day that we, I think maybe just a week or two after, that we had a lockdown in Vancouver. So there was no access to like restaurants or any other services besides essential services like the hospitals and grocery stores. And I believe banks, you could still access banks. So yeah, that it just happened very, very quickly.
And how long was the lockdown? Do you remember, Gloria?
The first lockdown, I don't remember exactly how long, but I think it was at least for a month at least. I feel like most of our lockdowns go in increments like of maybe 2 months, and then we assess how things are going, and then another 2 months. But I can't remember exactly how long.
And were you able to still serve the community, or you had to stop completely?
Well, at the beginning, we still connected with some community members through phone. So once the pandemic started and we started to realize like people need support in different ways, we started to adjust our programs. And for the seniors, instead of group programs, we increased the number of one-on-one phone calls, check-ins with them. So they happened quite often. So some of them were staff who made the phone calls, but we also have a large group of volunteers that we call the wellness connectors. And we called them up and we said, would you like to call some seniors during this pandemic and just check on them regularly? And many of them said yes. So each wellness connector also had 3 or 4 seniors that they called, and then the staff connected with them to see how things are going, if anybody needed extra support. So that happened, and then there was definitely an increase in food services provided. So rescue food that we normally package in grocery bags to deliver to some of the families. We increased the number of families that we were assisting and supporting, and got more donations from different sources so that we could provide to more of the families. So there definitely was a bigger effort to reach out to see who needed that support and add them to the list. And I think at one point we had about 80 families, like, yeah, maybe over like a week that we handed food bags to. And then the next transition, like after the kind of immediate support, was to bring back some of the programming so that people could still connect, and when they're at home and there's not much to do and they're looking for something to do. So we adapted to be online very quickly.
Oh, that's nice.
Yeah.
And Gloria, I know many communities went through a lot of struggles. And would you be okay to share with us something that impacted you, that you heard from your community?
Yeah, from our community, we did, like I said, increase the amount of food support for families who perhaps the parents had lost their jobs, or the seniors just couldn't get out to shop anymore. So there were definitely a lot more people needing that sort of support. And also slowly, as the pandemic went on, we started to hear of more seniors who just felt very depressed and lonely and unable to see, family or each other. They're very strong peer support, but not being able to come out, it started to become very, very difficult for a lot of people. So we definitely saw that impact, that the isolation was having a very adverse effect on the mental health of our community. And another thing that we noticed was that there was a lot of racism that started showing up, with people targeting the Asian community, because there were a lot of people who felt the virus came from China, that the Chinese were essentially responsible for it. So there were incidents of like anti-Asian hate that was happening, and more in the news. And then a lot of groups started to come together just to try to combat this or provide support. So it's like a lot of different factors started, to take place, and you could see it wasn't just about our health, it was like the community. So there were things that were kind of impacted in terms of the way the community worked together, or was tolerant or patient with each other. So there were like adverse effects, but there were also some very hopeful and meaningful things that happened, like groups getting together, just on Facebook, creating a Facebook group to share gifts that they could share with each other for free, like anybody who needed, an extra I don't know, some clothing or extra beds or extra even money, like people just created this group on their own and started to support each other through groups like that. There's also a lot of kindness that was shared.
That's nice. I know Frog Hollow is very, they help everybody. They try to include everybody. And do you remember any story like of resilience that you saw happening throughout this whole process?
I'm just trying to think of any particular
Or even
story.
for Frog Hollow, do you have anything that made you guys stronger, or any story that helped you? Like you're telling me about the Facebook groups, those are beautiful to hear about it. Is there any other story like that?
Well, we have, I think one of the most hopeful things that I've seen is how we have a very strong community of seniors who come out and do programs and meet each other. And before the pandemic, they had not been online or had never heard of Zoom, and were not very interested in finding virtual programs. But since the pandemic, there have been at least 40 or 50 seniors in the community who have learned to connect on Zoom, learned to connect with their families and friends over social media and different, apps. So that's very hopeful, because a lot of seniors might have never thought that they would learn this sort of thing, and here they are doing it, and still they're still very active on the programs. So that's that's very very hopeful for me.
And they are going to carry on this knowledge now and maybe continue for sure. Yeah. And Gloria, did you feel yourself isolated?
I think I'm very lucky because I live in the same house with my mother and my sisters and my own family with my 3-year-old daughter. So my daughter is still able to see her grandma. We didn't separate that much unless somebody started to feel sick. But, it was difficult not being able to see as many friends and only being able to see coworkers and the community members on the computer. But I'm sure I didn't feel that same sense of isolation as some people did. I really feel bad for those who live alone or who didn't have a garden or any outdoor space that they could walk around. That would have been very, very difficult.
Yeah.
I'm just grateful I'm in a spot where I can still support other people to try to get through it.
That's nice. Yeah. And I remember talking to you about the situation in Brazil, Gloria. They still have a lot of cases. They are trying to vaccinate people, but there are lots of issues in many cities. So what suggestions would you give to people hearing us? What suggestions would you give to organizations trying to help refugees and people who don't have any money? Poverty is big in Brazil. So do you have any advice for them?
Yeah, I know the situation in Brazil is a lot worse than it is here at the moment. And we really hope we can find a way to help, other countries with their struggles as well. As a organization that serves the community here, I think sometimes, just offering any little thing that you have is useful, and it really will make a difference with people, even if is not a lot, even if it's not like a lot of money or food. But if there's a way to even get a little bit from each community member, like perhaps there's a family that really needs some support with food, and the neighbors are able to create a campaign, or just you have to go that extra little effort to reach out and ask, who needs the help, and just ask, is it possible for you to just offer one little thing, a loaf of bread or a piece of fruit, and then offer it to that family to get them through. I feel like the world kind of shrunk a little bit during the pandemic, so that instead of looking outwards for support all the time, I felt like our communities often helped each other more locally, smaller scale locally, and realizing you don't have to go to the government or go out to find that support elsewhere. You can look within each person in the community, and then be compassionate with each other. if there are those who don't really believe in the pandemic, or who, for whatever reason, they're just having a hard time with this whole thing, with the whole idea, with the whole situation. They might act out, they might be emotional, but keep your calm and provide kindness and compassion. I feel like with our services, a lot of it is that kind of emotional support and mental health support that's very important beyond all the physical things. But yeah, just as a human, keep supporting each other in any way you can. And lobby, as I don't know, I know it's very difficult and the government system is different, but just lobbying and to raise your voice and say, we need this help, and to fight for that.
Yeah, and you made me remember something that it might be a good way to close it. Mental health support not always is just going to a psychiatry or to a therapist. It could be that, but I remember at Frog Hollow, it's always other things, right? Like maybe you can tell, like, so people can hear from you, like other little things that we do.
Besides, going to talk to someone, like you could do something with your hands, like create something, just even like drawing or something, creative that you can put your mind onto something else, play some music. I think there are actually one of the positive things about being more virtual is you can connect with programs from other countries. So, people in Brazil can, depending on the time difference situation, can actually look up Frog Hollow programs, and if there's anything they would like to join, they can get the Zoom link and they can join. So, you can meet people from different countries that way and see what's happening in those places. So that's kind of a neat thing that's going on. But I feel like a lot of it is just, trying to find those little things that give you joy in life, and if possible, going outside to connect with nature, talking to the trees and the plants and the flowers around you. It's really healing, actually.
Yes.
So everyone needs to just try to be hopeful through it all, and know that this is not the first pandemic that's existed in the world. Like in our part of the world, the indigenous community has suffered through multiple pandemics, and so the people who are here now, all of us, we've survived all those. So we are all survivors, and we can survive through this too. We just have to remain resilient and hopeful, and help each other.
That's beautiful. Thank you so much, Gloria. Hi, I'm back here, guys. So that was Gloria. As you could see, oh, am I working? Yes. As you could see, she had beautiful advices for us. And she talks about resilience. And I was looking for ways to talk about resilience here too. Let me see if I'm sharing my screen. Yes. Okay, good. Thank you. And is it showing? Okay, yeah, it is. So when we talk about resilience, we usually think about being strong, and being strong just because somebody is strong is an individual capacity. And then we start to think that if I'm strong, maybe others are not. So the literature about resilience always talks about being resilient, in being like having an ability to adapt during difficult situations, during trauma, adversity, or anything that is a stressor in our lives. But we are just now trying to understand resilience better. And we know that actually, in order to be resilient, we also need access to services. So, as you could see at the neighborhood house, they were working together. It's hard to expect somebody to be resilient just by themselves. It's really hard. It's like just a small number of people who are able to cope with hard situations by themselves. We usually need somebody else to talk, or we need resources like the ones the Frog Hollow was providing. So I just want to close talking about a little bit what resilience is. Instead of thinking just like you have to do everything by yourself or you have to be strong by yourself, think about resilience in the way that we are just discovering now. That is it's also access to social resources like having friends, having an organization that supports you, or having a group of people that maybe you go and talk to them, and also having environmental resources like going to a walk on the close to the trees, or just being close to a park. Those are things that help us to build our resilience. So it is actually, being resilient is actually a combination of our own individual factors, but also the social factors and environmental factors, that they all act together in order to help us to be resilient. Like I said before, a very small number of people are able to cope without resources. I cannot say nobody can't, but we believe that just a very small number of people. So this is a time to work together. This is a time to help each other. And like somebody at the Frog Hollow told me, we were never supposed to do this alone. So we need to provide support to one another and also let people help us. So this is how I finish my presentation here. I hope it was helpful for everybody. It was a little bit of the story in Canada. We usually think that only Brazil has struggles, but all places have struggles during the pandemic and other times too.
Wow, I'm speechless, Glaucia.
Nice.
Yes. First, because during your speech, we were interacting on the chat. And in the end, I realized that, yes, simple actions do matter. But within a reality in which we have very little upon which we can rely on, a rising number of people and families who start losing everything they have, or the things that they have struggled so hard for decades to achieve, and within months they lose, and they have no expectations whatsoever to have ways to get them back, or to at least have something. I think they are not excuses for not act, but it becomes harder when you don't have at least some dignity from the governmental policies, or at least some kind of infrastructure that can give you support. That's no excuse whatsoever for not act, and individually, for not being compassionate, for not caring for the ones that are just besides us. But of course, in a world like the one that we live, it gets more difficult. It is more complex, I think.
Mm-hmm. Yeah, and like in this organization in Canada, they have a lot of resources available, and they actually receive some money from the government. But the need is so great, Carla, that is not enough. So what they do, they realized that the government provides some assistance, but it's not consistent. One thing, and the second thing is the need is so big that they have to do like campaigns to raise money. They have a community garden. They plant things and they have fruits and vegetables coming from their own garden, and they distribute to the community. So they came up with these ideas of having seniors to volunteer so they can provide more support to people. So although we need, of course, the support from government, like they also do and they have, sometimes we also need to come up with ideas that may help us with services, for sure.
Yeah, certainly. We have a lot to learn with these initiatives because although Brazilians are known for their compassion towards people, and we are, right?
Yeah.
Sometimes we forget to, we tend to isolate ourselves and maybe in a protective way, not to being bothered by our neighbors' necessities. But yes, we certainly need to help to learn a lot with these kinds of initiatives. But there is another question that I wrote down. Your presentation is about visible minorities. I was wondering if there would be invisible minorities in Canada, and what would they refer to?
They actually called visible minorities because it became like visible. People coming from China and other countries. At the beginning, it was a small group of people and now became bigger. So they call now visible minorities. But the invisible, I think some ethnic groups, like we have a lot of people from small countries in Africa that become the invisible there, or like small numbers of people that do live in Canada, but sometimes it's such a small number of people that it's hard to forget about them, like their needs, because needs will change accordingly to your culture and your background and your age. So there are some people who I think are invisible right now, and some of them are small countries from Africa.
Would you say that sometimes societies unconsciously or involuntarily could arrange strategies to not, or to prevent them, the society, to see the people? Because well, I'm thinking about some communities here in Uberlândia, for example. I don't know if everybody is aware of that, but we have a strong community from people from Haiti, from Venezuela, and also a growing community from Syria. And I see very few initiatives here in Uberlândia, both public and individual. We do have a very strong organization that has grown into force, which is TAARI, that provides these immigrants some support. At UFU, I don't know if everybody is aware or familiar, we do have a project for teaching Portuguese for immigrants that provide them some insertion into society. But they are very few initiatives, and I have talked to a few members of these groups, especially from Haiti, and what they say is that they love it here. They feel that the population is very welcoming. but they do not feel that they will ever be included into the society, into the regular flow of the society. In terms of jobs, in terms of recognition, they have a very hard time to get accepted in certain jobs, even if they have a very good formal education. So would you say that there are some disposals that make these people invisible?
Yeah, I think so, Carla. I think sometimes there's a lot of fight for resources in many places. We think about fighting for resources. We think that this is something from the past, but actually it's something very current. So sometimes, like in Canada, it took me many years to be part of the community because somehow I came from Brazil. My degree was not recognized. So I think the government and the population sometimes they feel like threatened. So it is a threat. So you're gonna steal my job, or maybe you're gonna steal some resource that I have here in this land. But we need to remember, like, I think that is the job of some organizations, and that is something that I learned at Frog Hollow. Besides helping these people who speak Portuguese, for instance, and in Canada speak English, I think we also need to engage them with the population, and we also need to learn their ways, like to eat, or their ways to do things. So then we have like a collaboration of things, like at Frog Hollow, a small thing that we do is like bringing dishes from your own culture. So then everybody shares. So it's an easy way. Nobody has to try anything, but if you want, you do that. So it's a very subtle way to introduce people to the community and also make the community get to know them. Because when you don't know them, like, because usually in sociology we call them, which is horrible. But if you don't know each other, it becomes something like, you should stay there and I should stay here, and this is my country. But I think somehow organizations can help with that, and also the government, because if your degree, for instance, is not recognized, then what can you do? Or even your social status is like lower. If you come from Haiti, your social status in the society is lower. So we need to address those things. And maybe we need to hear from the community what to do in order to include everybody.
Yeah. Well, one last question that our audience wrote down is if the organization is a government action, or if it was an action from the community.
It's not from the government. Actually, there is an association of neighborhood houses. It was a group of people who came together, and many years ago, we started to do those neighborhood houses. And then after creating the first neighborhood house, they started to connect with the government. And then from funding and projects, the government started to give them resources. But again, it's a fight for money, because everything has to receive funding. So they usually have donations, like the food that they provide, Carla, it's from local business, and they collect everything that is not sold in the stores. They send to the neighborhood house. The neighborhood house sorted out, sees what is good, what is not, and then they send it to the community. So they have a lot of partnership with local business, and they have some funding from the government, which is not enough. That's why they keep doing fundraisings, but it wasn't a government action. It was the community.
Well, yes. So thank you so much, Glaucia, for joining us today. Well, Helena, Professor Helena from UNASP, joined us, and I think you know that her, right?
Yes, thank you, Helena.
So thank you, everybody. Ana Laura, Gilmar, our technicians and friends and colleagues, and everybody who has stayed with us until the end. It was a long day, but for sure, I think I learned more than today than in a year time, I think. So
Nice.
Thank you very much, and let's wait for the next DCD Day next year.
Thank you so much, Carla. It was a pleasure being here.
So bye, guys.